Yes, do it. Do
Hi,
it.
everybody. We are live on Facebook, YouTube, and Instagram. I hope everybody hears us okay. If you have any issues with our sound being uneven or anything of the sort, please comment and let us know. We'll do what we can to
Yes.
fix it as we are discussing today's topic.
Medical error.
Medical
Yes,
error.
we're talking about medical errors and
Yeah,
specifically veterinary medicine. But I don't know about you. They don't seem to track that as well as they do in human medicine.
they don't. They
Yeah.
definitely don't. I found an article
Mhm.
about the situation we're going to be discussing. This happened
Yeah.
sometime in the beginning of August in Chicago. So the article I'm reading is from NBCChicago.com, and it is a local news article for Chicago. The title is Dog Scheduled for Teeth Cleaning was spayed by Chicago vet instead, owner says. Published August 7th and updated August 7th. And the owner is a young woman, I believe, and she took her Cavapoo, 10-year-old, a 10-year-old Cavapoo,
I
to the
mean,
vet for a deep cleaning. And this menopausal dog was spayed.
yeah. Yeah. I mean, first, I have so many things. First of all, okay, this dog is already 10 years old. If you are being intentional about not spaying or neutering your pet and you are a responsible pet parent, you are doing it because it is better for their health. I get that. At least by the time they're 10 years old, they are fully mature. You have so much less time to deal with the after effects of losing those hormone producing organs. So that's the only silver lining I see in this.
I don't know, man. I don't know. Going from producing hormones for 10 years to like whoop, gone
Yeah.
in those senior years. I
Yeah.
mean, holy hot flashes for this poor dog. And like,
Yeah.
I personally, when I first saw the title, I was thinking it was like a younger dog, right?
Yeah, I
But
did
just
too.
think about an owner who's so passionate about not spaying or neutering for whatever the reason may be. I don't know if the article mentioned it. I don't believe she mentioned um why she had not spayed her dog, but let's just say that she wanted to breed her or that she had pre-existing reasons not to get it spayed, whatever the case may be,
Yeah.
medical, optional,
Yeah.
whatever.
Yeah.
She did like 10 years worth of menstruation management for this dog, which is a lot of work.
It is a lot.
It's a
Yeah.
lot of work. It's not pleasant. And as soon as the dog is maturing to a point where, like, she's getting to her senior years, maybe not menstruating as often,
Yeah.
now her ovaries and her uterus are gone. And that's what a spay is. It's a full
Yeah.
removal of all of the reproductive organs of a female pet. So she went in for a dental, which at 10 years old, for sure, definitely a good
Typical.
idea. Getting in there, getting those teeth cleaned, extending her life. And it was not done.
I
Like the
I
dental was
yeah.
not done. It was
As far as I can tell, I
no,
mean,
it was not
yeah.
done. It was the spay
And
that was done.
and the thing is that what might make me even more upset if I were in this position is that now I have a 10-year-old small dog. So, you know, I mean, granted, larger dogs tend to live shorter lifespans, but she's already 10 years old. And now, what, I need to put her under anesthesia again because she probably needed that teeth cleaning.
Oh yeah.
And that's scary. Anytime any animal or human or animal goes under anesthesia, like we just look at that as routine. And yes, in a sense it is because it happens every single day for thousands and thousands of animals and people every single day. But that doesn't negate the risk and the danger of it. And so that might be even more so what would upset me is like, now you're telling me I have to put my dog under anesthesia yet again, because there's probably a pretty good reason why that dog was going in for a dental cleaning.
Yeah, I mean, she was 10. She probably needed it. And she's a Cavapoo, so she's a smaller dog, right?
Small. Yeah.
And so I'll read a couple of items from the article here. Again, it's from 5 Chicago, NBCChicago.com. Martin Jenkins said her dog Savannah got the wrong procedure done Monday at Banfield Pet Hospital on Western near 95th Street in Chicago's Beverly neighborhood. She showed NBC Chicago the Banfield's calendar reminder message for the teeth cleaning, as well as the aftercare instructions and medicine she received after Savannah was spayed by mistake. I'm floored, she said. I'm like flabbergasted. I'm like, what do you mean she got spayed? Martin Jenkins said. I literally dropped her off for you to be in her mouth and you took out her uterus and ovaries.
Yeah.
She says that they never wanted her neutered. So that was not going to be something they even did in the future. I happened to see a dog that just got spayed and the stitches were like horrendous. Like they were big. It just looked like the dog was in pain. I was like, never, no. So she chose it based on just her not wanting to put her dog through that, which, by the way, like we're not here to agree or disagree, but like I've spayed all of my pets. They recover very well if it's done properly.
Sorry.
The issue is not usually the surgery, it's the hormones as it affects the body and the side effects that I'm more concerned about personally than the surgery. A surgery that's done right on a healthy dog is usually fine.
Yeah. Sorry. We have somebody at the door. So yeah, no, that's a big problem. And quite honestly, this is.
Do you want to mute yourself and I'll keep reading?
I don't know how to mute myself. On Instagram.
Oh, on Insta, I don't know how to mute you either.
Hang on. Let me just grab her. Hang on one second. Kim, thank you. Okay, maybe she'll.
I think she's done. It sounds like she's
right.
She's on the way out of her.
Sorry about that.
Moment. It was something she never wanted to do.
This is one of the reasons why I never, ever, 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 ever recommend Banfield. Not that it can't happen other places. It absolutely can and does. But Banfield is, first of all, possibly one of the worst experiences, in my opinion, that your pet could go through. So many people just go in and drop their pets off and leave for the day. And that's kind of like how their system is set up. Like, yep, drop them off in the morning before work, pick them up after work, you're good. Like, how terrifying is that for your pet? But it very much, and I don't know that this is like something that they say they are, but to me, it's very much a training hospital, because their overturn is like everybody that I have ever talked to anytime, because when I first met my husband, he had his dog enrolled in their wellness program, and that's what he did. He dropped her off in the morning, picked her up in the evening, and there was just so many things that went wrong. And so I met some veterinarians there. Every time you go, it's a different veterinarian. They don't know your pet's history. They don't know your pet at all. They're always just out of vet school. They come in for a couple of months, get some experience, and then move on to another vet clinic where they can get paid more because now they have experience. That's, to me, what I like, in a nutshell, how I see Banfield. It's also checklist medicine. So they come in fresh out of vet school, and they have a computer saying this dog needs XYZ. And if you're saying that, and these are the symptoms you put in, so this dog has this, and this is what you need to prescribe, and this is the food they need to be on. And if they don't follow those check boxes, they're actually penalized. Like they have to, that's what they have to do. And so I'm just not a fan of Banfield, if you can't tell.
Well, I mean, we did talk about the corporate buyouts of
Yeah,
veterinary clinics.
we
We
did.
talked about that. If you missed that live, that was probably in July, maybe. I think we did that.
Maybe, yeah.
And it should be on one of our feeds or both of our feeds. And
Mhm.
what you find is that obviously the service levels drop because it becomes more about profits than about the service. Whereas most of the veterinarians that establish a practice, a private practice, are so committed because not
Mhm.
only is it their practice and their investment, it's also their name attached to it,
Yeah,
right? So
yeah.
it is usually a lot higher stakes for the individual than the company who has like 1,000 vet clinics and one of them makes a mistake, right? So
Yeah.
they can be like, well, we'll improve and then, fall back on the fact that everybody else is doing okay. So one of the things that this highlights is all that we discussed about corporate buyouts, reducing the quality, making the process more impersonal, more checklist based. Obviously, their checklists aren't working because this is
Yeah,
not like a teeth cleaning should not
I
include
know.
any kind of reproductive attention, reproductive system attention. So even their checklists weren't working.
I do wonder if like another dog got a dental cleaning and didn't get spayed. Like I wonder if,
Exactly.
you
So
know?
they haven't updated since August 7th. The owner says, I think some responsibility needs to be taken. And I think they have to have better protocols in place so that this doesn't happen again. What if it was more severe? What if it was like another surgery? What if she was scheduled to be put to sleep? I mean, let's hope that they're used to seeing somebody with a pet and wouldn't put a pet to sleep without their person. But yes, if you're
Yeah, that's
making a
an issue.
mistake, now I have to worry how deep your mistake is going to be next time. So yes, I totally hear that. Banfield spokesperson said in a statement that it has existing measures in place to prevent errors, and they're investigating the case. The quote from Banfield is, at Banfield, the health, safety, and well-being of pets is our top priority, and we're committed to providing high quality care to the millions of pets we see every year. There you go. There you go. We made a mistake here, but thousands of our veterinary clinics are doing great.
Yeah.
Banfield has existing measures in place to prevent errors from happening, and we're thoroughly investigating what occurred. All other patients in the hospital received the intended care they were scheduled for. So nobody else got the teeth cleaning, as far as they're saying. We're taking this matter seriously and working directly with the Martin family to address their questions and concerns, as well as extend our sincerest apologies. We're glad to hear Savannah's recovering well and remain committed to providing and covering the cost of any related care. That's it. That's it. So we share these things not to like scare people, because this is a very isolated incident and this is something that probably won't happen again anytime soon. Heaven forbid it does. But the reason we share these things is because you as a pet parent can arm yourself in ways that prevent errors. And we're going to talk about those today, because as more veterinary clinics are bought out, we need to be a little bit on the defensive, right? Like when we drive, we're a little bit on the defensive, right? We're not just worried about what's in the car, because we're sharing the road with other people and their mistakes can affect us. Same thing with our doctors and our veterinarians, my kids' pediatricians. I'm going to be observant. I'm going to be looking. I'm going to be watching for signs that they don't have their SHIT together. And then I'm going to either leave, plan accordingly, find another vet, et cetera, et cetera. So that's really what it comes down to. It's listening to your gut. I don't know if this person had other choices for veterinarians. I don't know. There are people who are in like veterinary deserts where they have like one veterinarian in like 100-mile radius. So going to another vet is hard. With these corporate buyouts, the chances of finding an independent veterinarian are getting slimmer and slimmer. So you're kind of dealing with either Banfield versus whomever else is the corporate entity that runs all of the vets in your area. So we don't want to demonize veterinarians. Veterinarians are there to do their job. It's just that these corporate buyouts are making their job harder. They're making it harder for them to remember pets because of the volume of pets they see per day. They're making it harder for them to provide quality care because they shorten the visit time and the time that you have to discuss your concerns with your vet. So it's not the veterinarian's fault. It's just the structure of these corporate buyouts, and the fact that even though they say that the priority is the health and wellness, I would venture to say that for a lot of corporations, inevitably the priority is the profit.
Yeah. Oh, absolutely.
Because
And
they can't stay afloat if they don't have the necessary amount of profits. And unfortunately, somebody gets overlooked, just like this poor Cavapoo.
I know. But and with Banfield specifically, just because I have experience with them, there is no accountability. Like I was just saying earlier, you go in from 1 month to the next and you're not seeing the same veterinarian. Like you don't have that personal relationship. There is no accountability. There is no, well, last, 6 months ago when I was talking to you about my pet's whatever diagnosis, like that doesn't happen.
Mm.
And I mean, like you were saying, that's just the reality in some cases. And there's obviously demand. People are still using them and not it. I don't know if it bothers them.
We're between a rock and a hard place, right? Because
Yeah.
again, if you're in a veterinary desert, you get what you get. If you're somewhere where they're all corporations buying out all your vets because prices are so high that your vet can't cover, like even their rents of their space, then you're stuck. So like it really does kind of leave us, and with the veterinary shortage as a whole, like it leaves us between a rock and a hard place because some of us don't have options. Like I'm very lucky, you're lucky.
Yeah.
Right now
For
we have
sure.
options, but that could change, right? So like
Mhm.
we're very much aware that that's something that's changing, and there's no talk of anything changing it back to the way it used to be. So
No.
we should just assume that this is going to continue and it's going to gain momentum, and there's going to be a day where
Mhm.
like a veterinary clinic that's individually owned and operated is going to be an anomaly.
Yeah. So I kind of looked up some of the different types of medical errors to be aware of. So then we can maybe give people a plan or some ideas of things they can do to protect themselves. There are diagnostic errors. So not reading labs appropriately, not reading an x-ray appropriately, different things relating to diagnosing, which I actually see quite a bit, especially with blood work. So many times I see people come to me with, say, lab work, and they're like, "Oh, well, my vet said my dog or cat is in early stage kidney disease," and I'm like, "Okay, where's the urinalysis that went with this blood work?" They didn't do a urinalysis. Well, we don't have a complete profile. Like maybe your cat or dog is just dehydrated. Like there are diagnostic errors that happen every day. Treatment errors as far as medication. I personally had a cat. I don't know if I've said this on here. I had a cat a number of years ago who was diagnosed with IBD. And so prednisone is the steroid that most of us are very familiar with. Cats cannot metabolize it. There's an alternate called prednisolone. And my vet tech gave us prednisone instead of prednisolone. So I went for an entire month on the wrong medication, a medication that my cat could not metabolize. And it was a mistake, but it was a mistake compounded with other mistakes that were going on that I wound up going and finding another veterinarian. But these are things that happen. Surgical errors, obviously, we just talked about that. And then one of the most important ones to me are communication errors, like not giving you the full story, not giving you the full picture, telling you need to do XYZ without telling you why. Like that bothers me more than anything. I want to know the reason. I want to know why you think my dog has kidney disease. I want to know what the root cause is. Don't just hand me a prescription and say, here, let's get rid of these symptoms. And so like there are communication errors, and then there are procedural errors, which obviously happened in this case as well. But that communication, I think, is one of the most overlooked things that we can be doing as pet parents. That first of all, when you take your pet in for anything, you need to be having a conversation with the veterinarian. And if you go in and hand your pet off to a vet tech and never talk to the veterinarian that's going to be performing that procedure, for me, that's the first mistake we're making. because I want to talk to the vet. I want to know they got enough sleep last night. I want to know they're on their A game. I want to know that they know my pet, that they've already looked at my pet's record. They know who I am, what my pet is there for. And that little 2-3 minute conversation could have changed the outcome for this dog, in my opinion.
Absolutely. Well, I think it's really important that we start prevention from the day that we choose our veterinarian, and people are scared to make changes, and that's one of the things that can really cost you, whether it be with veterinarian, with a service provider, with a groomer, a pet sitter, dog trainer, whatever it is. If something sets off alarm bells, you need to listen to yourself. So the first thing is, like, when you're choosing, like, let's say you just brought your pet home, you don't know, it's your first pet, or you moved somewhere, you don't have a veterinarian, do your research. Like, don't just choose the guy who's closest to your house. That is a really poor way of finding a veterinarian. Find it by talking to people. You can find local groups these days for every town. I mean, I lived in a tiny town in Louisiana, and we had a group on Facebook where we asked recommendations and questions. If you're a military spouse, there are a million military spouse groups. If you are a natural pet person, where there's a ton of pet groups you can ask, and maybe you can ask if there's like a local group, or you can start a local group, or you can go into like your mommy's groups, or whatever it is that you have access to, and ask people for recommendations. But don't stop there. Talk to people you know who use those veterinarians, that office, and ask them about the vet, about the bedside manner, but also about the front office. Are they nice? Do they answer? How far are they scheduling out? Do you feel like you were rushed when you go in there? Have you ever had any issues? What do you think about their pricing? Those kinds of questions are not to be like nitpicky. It'll get a conversation started. So, like, I have a friend down the street who had a really poor experience with a veterinarian, and she ended up at mine, and she's thrilled, and she is very diplomatic though. So if you were to ask her about a vet, she might be like, oh yeah, I used to use them, but now I use somebody else. But she won't tell you why. She told me because she was complaining to me, and that's when I recommended my vet. But a lot of people won't share the true reason why they may be moved. So if somebody moved from one vet to another, that's a red flag. That should be a red flag for you, even if they're not giving you details. If they're talking about how great the vet is, but they're complaining that it takes forever to get an appointment, or that the front office is dismissive, or that there's a vet tech there that your pet doesn't like, that's a red flag, right? Because that vet tech's gonna be taking care of your pet. So if there's another option, maybe go that way. Ask questions, not just you like them. Ask more detailed questions, like about their front office, because you wouldn't know unless you ask. Because a lot of people are just kind of not trying to be like haters, right? They're not trying to like bring down the conversation. They're not trying to come off as Karen. So they're going to keep it to themselves unless you really start kind of asking and getting that conversation going. And then also, if you decide to go with a vet and you decide that it's not for you, again, you just got a pet and they're very like dismissive of you, maybe they're better suited for an experienced pet parent and not a newbie pet parent, right? So find one that really is more nurturing for that newbie pet parent. Because I remember as a newbie pet parent, I was at the vet all the time, and I had wonderful vets that taught me so much about being a pet parent. So that is, you can either get that, or you can get the office that's too busy for you and doesn't want to answer your questions. And if you don't have experience, or if you have like a special needs pet that you've never had before, you can't risk having a dismissive veterinarian. So walk away. If it comes to the point where you're like, this isn't working, walk away. Walk away from your pediatricians. Walk away from your gynecologists. Walk away from your surgeons. Walk away. If they're not the right person fit for you, they're not giving you the warm and fuzzies, their bedside manner sucks, walk away. Don't just be like, maybe I'm overthinking it. Take a pause. That's your inner voice. That's your wisdom telling you something's off. Listen to it. And then, like Jessica said, continuity is so important. And if you are choosing between a one person or one veterinarian practice versus a 5 veterinarian practice, my recommendation is always to go to the one veterinarian practice. one or two that team up is fantastic, because obviously then you have backup. Like my veterinarian is, I adore her, she's wonderful, but she had a family emergency and we couldn't get in for like 2 weeks. We had to move stuff around, which thankfully was not an emergency situation, and she is a primary veterinarian, not an emergency vet. So we worked with it. But if that's not going to work for you, then maybe find one with two that you can back up. But the second you get to 3, 4, 5, 8, 12 veterinarians, you're just going to be shuffled around. So I think Jessica would agree. We say continuity is key. If you can find a veterinarian that gets to know you and your pet for the long term, that is truly the holy grail. And then don't be afraid of getting second opinions. Like, even if you love your vet may not be giving you what you need, may be kind of addressing something. Like my veterinarian said that Titan had degenerative myelopathy. I don't know for sure that that's the case. That was the diagnosis she gave. We did not do an MRI, so we couldn't verify that. But when I joined groups about degenerative myelopathy, I learned that really the only way to diagnose that is with an MRI and is with a genetic test. So I didn't do the MRI because I didn't want to put him through that. It wasn't going to do anything for me. And I did do the genetic test, and he did not have any markers for degenerative myelopathy. But as far as my veterinarian is concerned, that was the diagnosis. As far as I'm concerned, I'm not so sure.
Yeah.
Thankfully, whatever it was, the treatment was the same. So we did laser, we did acupuncture, we did all these things to help him. But again, like, that was okay because we aligned on the treatment. But if you're not convinced that a diagnosis is right and you're not sure about the treatment, then for sure get a second opinion. Don't just settle for what you were given. And then, like in this case, it was such a silly, like, simple procedure. But what if it had been something that, like you said, they had to have, like, they have some kind of tumor that needs to be removed, some kind of, ACL that needs to be repaired, something like that. And now they're getting like a neuter or a spay instead. Like,
I
that
know.
under again. So, like, if there's anything that you feel like is not quite right, you've got to listen to yourself. And then on the day of surgery or on the day of the procedures, like Jess said, talk to the vet. And like I said, I have a small vet, so the vet office is like just two offices, one for cats, one for dogs. That's it. And so when I'm dropping anybody off, she's right there. She's like either in the front, or she's moving, or she opens the door and says hi. So she sees me. So even if she gets confused with the pet, now she's seen me and she's like, oh, the errata dog or the errata cat, right? So, like, seeing helps remind the person performing the surgery or procedure who you are. And if they see somebody and they're like, oh, wait, I thought this was the other Boomer. Oh, Boomer Arata. This is not Boomer Fisher. Okay, got it, right? Like, people go on autopilot. People do. That professionals go on autopilot all the time. Our doctors, our veterinarians, they're professionals. They get so good and they get into this rhythm that they can go on autopilot. So seeing your pet is a really good reminder. Verifying with the person who receives the pet, what time, how long, when do I find out, how long is the procedure. Asking questions can remind them what it is that you are there for. And if there's let's say that the person had come in and asked a bunch of questions of the vet tech might have been like, wait, this dog's not here for a spay. This dog's here for a tooth cleaning because the mom asked me about extractions. So that communication is not only key to your peace of mind, but it might actually remind the vet of what you're there for, what previous conversations that you've had with them, because they do see a lot of people. Like, they do see a lot of pets and people, even the smaller practices, every single day.
Yeah. Well, and that brings up, other questions that we should be asking prior to procedures. But hopefully that there is some vet tech in there during a procedure to be monitoring the animal under anesthesia while hopefully the veterinarian, though in some cases, like for dental cleanings, some higher level vet techs do sometimes perform those procedures when in offices. I've heard of that happening before. But that's also something you want to know. So, like, ask all the questions. I don't want to be that, like, I never want to be that person that I feel like I'm bugging something. Like, I have that personality trait where I'm like, I'm bugging somebody, blah, 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 all the things. And I have had to get over it because it is more important to me that I know what's going on with my pets. It's more important to me to ask all the questions so that when I do walk into the veterinarian's office, my veterinarian is like, oh crap, she's on top of her game. So I better be on top of my game too, because I have asked all the questions. I asked about their anesthesia protocols. I asked about who's doing the procedure, because to me, and I, with the veterinarians that I have now, because I do have multiple veterinarians for my pets, um, I ask so many questions and they get to the point where they just tell me that they're uncomfortable, that like that's not something that they are used to doing. Maybe it's something that they will do the research on, but like
Right.
there in certain practices can be just one person.
Yeah.
One of the veterinarians may be performing dental cleanings. Maybe one of the other veterinarians is more of a cancer specialist. Like it's like we walk into a veterinarian's office and we have no idea the amount of information that they have to have stored in their brains to finish veterinary school. How many different species that they have to know everything about, all of the biology. Like, to me, it is so much more impressive than a human
Oh
doctor,
yeah.
because human doctors only have to learn one species.
Yeah.
Right.
And they usually
um
specialize, right? So like,
and
yes,
they,
like
yeah,
your primary care physician will be like, okay, you need to go to the OBGYN for that. And you need to do, but
right.
your vet is doing all of that work. And I will say this, I mean, this is just an example that happened this weekend. I take care of my grandmother. She is an assisted living, but I manage her medical stuff. And I asked one of her med techs, which is, like kind of like a nurse adjacent, and they focus on the medicine, and I asked what dosage of one medicine she was on, and the person was telling me she's not on that medication, that's a narcotic. And I was like, that's not a narcotic, one, and yes, she is on it. I'm pretty sure I discussed it with the doctor and she's on that. She wouldn't be on that because that's a narcotic, she doesn't need that. And she's like outraged, and I said, it is not a narcotic. It is, that is what she is taking. She was on 25 milligrams and she goes, oh, 25 milligrams would kill her. It's a narcotic. And I was like, again, that is not a narcotic. I don't know what you're talking about, but this medication she is on, and I need to know what if she's still on the 25 milligrams. And she's telling me that the I don't want to give, information
Yeah,
for
yeah,
my grandmother's privacy
sure.
away. But I got up, got my son was playing with my phone. I did a search and I said, here you go. This is the medication I'm talking about. This is what you just told me she's on. I don't know what you're confusing it with, but this is what we're talking about. And she had been like, oh, I've been doing this for 14 years. I know my medications. And so you have to remember that people get comfortable.
Yeah.
People kind of get to the point where they think they know. And even if you've been doing this for 14 years, 15 years, 25 years, I don't care. You're like 2 weeks from retirement. I don't care. If something sounds wrong, which it did to me, I was like, one, I know people who take this. It is not a narcotic. It is this type of medication. This is how much you start with. So I was wondering if we had increased it, which we haven't. So we have to speak to the doctor, which is why I was asking. And I don't care how long. When you're telling me I've been doing this for 14 years, but you're not Googling anything, we have a problem. Because I was able to verify that she was incorrect in 2.5 seconds, thanks to Dr. Google, right? So
Yeah.
we have the ability to like really focus on what we have access to. We do have access to the names of medication. So these errors that happen with medication, you can prevent that by looking up that medication. I do it with my kids all the time. Like if, they have like a virus, they give them all this stuff. Like, you go to urgent care, you leave with like 8 things and you're like,
Yeah.
really? I mean, I was sick, but I don't know that I need 8 things. Right. So I'll Google each one and I'll be like, I don't like the side effect. We'll see. I'll put that one aside for later. Or I don't know about this. his cough's not that bad anymore. I'm not gonna do that. I'll fill it all. I fill it all because, you know, it's thankfully we have insurance and it's covered, and I'll take it just in case something gets worse. But I don't think that we need to just open the tub and like give our pet something, just like what the experience you had. We have the ability to verify their work, check people's work. Don't just assume that, you know, especially with cats, right? Because cats are the ones that are the most sensitive to medications. They have a really hard time metabolizing certain things. Their livers are very sensitive to different things, even in the natural space. Like, you don't want to use just whatever, you know, somebody recommended down the street for fleas. I know somebody who killed a kitten by mistake, not her fault, trying to use some kind of natural flea and tick thing. Okay. So check your work, check whomever's work. Don't take anybody's word for it, even your veterinarians, because they can make mistakes. I don't care how long they've been doing this. We're human. And like, when we work together as a team, we reduce the chances of these things happening. And when you go in for the actual treatment, like if my dog is going in for a dental, I'm gonna put an X on her belly. Already spayed. Like, now I feel like I need to be like the crazy pet mom who's like already spayed. Titan had a little tattoo, right? So I used to like when they did that, where it was like he had a tattoo that kind of signaled that he is neutered. He was neutered.
Yeah.
I've never seen any other pet with that, but like, let's go back to that. Like, if they wouldn't have solved this problem, but do you want your pet being opened only for them to find that their reproductive organs are already gone? No.
Yeah.
So like, we need to find solutions as we move forward in this environment where vets are so overwhelmed, and they have to start with us. Like, they have to start with us being like, you know, talking about medical error, straight up asking your veterinarian, how do you prevent medical error? What do you do so that when I bring my intact pet in, you are not taking out their reproductive organs, especially if you are one of these people who is either waiting or does not want to spay or neuter. These are conversations you need to have, because obviously it's happening and obviously it can happen again. So if you're one of these people, my pets are already spayed and neutered, I don't want them open, you know, for no reason. But if they were to be somebody that I don't want spayed or neutered, I would be very, very careful, especially for all of those, because I know a lot of people are. You're waiting for later in life. You're waiting for after the 2-year mark. You're waiting for 5-year mark, whatever it is you're waiting for. You need to make sure your veterinarian knows that, the team knows that, and that they won't make any mistakes. So ask their questions, and always, always, always get a written estimate of what you have agreed to. Because let's say that this person did not have a written estimate. Guess what? It would be a he said, she said, and she would get none of the things she's entitled to, because you know that these lawyers would find a way out of covering this mistake and of taking accountability. So always have a written estimate of what is going to be performed from your veterinarian. Discuss it, review it, Google it before you bring your pet in, because they usually give it to you, you know, during the blood work visit, where you like your pet gets blood work so that they can make sure that they're healthy enough for surgery. That's when you're usually given the estimate. Tear it to pieces. Take the time. We don't take our pets that often to get surgery. So when they do get surgery or a dental cleaning, take your time. Really do your homework and do your due diligence.
Yeah, I agree with all of that. And it is going to be, as you were saying, with just the state of veterinary care, with the corporate buyouts, with so many veterinarians retiring early, with not being able to get appointments for weeks and months, with not as many going through veterinary school. Like it's to a point, like we as pet parents do have to be so much more alert and responsible and take these. I mean, really, we always should have.
Yeah.
But we've gotten comfortable. Is the truth.
And things have gotten worse. Yes, like it's like both things happening simultaneously. We've gotten comfortable and things are getting worse. So now we're seeing these things pop up. And the only thing I'll add is we have to get into the habit of doing this for ourselves, for our kids, for our pets, for
Yeah.
everybody, because there's there are doctor shortages everywhere too.
Mhm. Oh yeah, and insurance. The reality is insurance companies are practicing medicine and tightening. Like doctors can't even do their jobs when we think about, well, both in human medicine and veterinary medicine. We talk about veterinary medicine following the path of, that checkbox medicine, and these are the symptoms, so these are the pills that I'm going to prescribe.
Mhm.
That's exactly what they're doing. And in large part I think due to the corporate buyouts, they're just following the exact same procedures that human medicine has been doing. And again, we've gotten comfortable with it, I think, but we have to be our own advocates. We have to be our children's advocates. We have to be our pets' advocates and demand better and demand more and ask why. And just ask all the questions. Be that person that they're like, ah, they're so
Yes.
difficult.
Yes.
Okay, I'm glad I'm
Going back
difficult.
going back to what you said about not wanting to bother people. Yeah,
Yeah,
those days are gone. Like those days are
yeah,
gone. You can call me a Karen if you want, but like if I'm entitled to something, I'm paying you for a service and I'm not
yeah.
getting what I signed up for, we're going to have a very serious conversation. And I don't really I'm respectful, but I'm firm, and I don't really care if you don't like the fact that I'm questioning this. Yes,
I'm so
Diane is
sorry.
telling us that her cat declined yesterday. She couldn't get into her regular vet. She got an appointment with an amazing vet, but sadly, when scanned, the cat had a massive tumor on a cyst or
A
tumor
mass
on
in the
a mass
liver.
on her
I'm
liver.
going back
So
up to
she
another
had
one.
to be put to sleep. Tiger was her cat who had hyperthyroidism, sadly became anemic.
I'm so
I'm so
sorry.
sorry to hear that. It's just such a hard time. I mean, this just happened yesterday, so I'm sure your
I
heart is raw
know.
and torn up, and my heart goes out to you. Our most sincere condolences, Diane.
Yeah. And sadly, I just had to let Romeo go. He was hyperthyroid. I still have Sissy, who's also hyperthyroid. So I am hyper aware of the fact that it hides kidney disease. That I'm very much aware of the fact that I need to be on alert for and as I'm sure you were too, um, any sudden changes in mood, behavior, what she's eating, what she's not eating, changes in the litter. Like I'm very
Yes.
hyper aware. I'm hyper aware with all of my cats, but when I know that there's something that I really need to be on the lookout for, I'm like hyper vigilant, and that's just, it's the sad reality of the toxic world we live in.
Yeah,
Oh,
the the kidney was good on the blood work. Yeah, that's how it happens. That's what happens. It hides it, right?
so if I'm not it's the hyperthyroid medication that kind of hides that on
Yeah.
panel. I believe I'd have to double check that, but I'm pretty sure that's what a couple of
And
vets
that's
had
why
told
it's
me.
so important to know your breed. It's especially with dogs. I just
Yeah.
did an episode with Trisha Montgomery of Moose's March, and we talk about these cancer detection kits for
Mhm.
dogs that she's part of, bringing to the forefront. And she talks about, knowing your breed's predisposition to things, cancer, hyperthyroidism, there are Cushing's, things like that, that breeds are predisposed to. Knowing those things is so important because then you can start the conversation with your veterinarians early, start asking questions, stand out as a really prepared and interested and informed pet parent to your vet so that you can work together as your pet ages under their care. I feel like the way that my veterinarian kind of talks to me is different than the way she talks to a lot of other pet parents, obviously in your case as well. And so she knows that I'm aware. She knows that I'm going to ask intelligent questions. She knows that I'm going to challenge her sometimes with questions that maybe she's not able to answer on the spot and she has to research and get back to me. So having that conversation, those conversations where your veterinarian knows that you're really committed, really dedicated, alert, aware. You really do want to start talking about those predispositions with your vet and getting that conversation going, getting it in the file, always getting stuff in the file, like that, can you please add that I'm concerned about, the medication covering up kidney failure in my hyperthyroid cat? And can we talk about what we do to figure out, how the kidneys are truly functioning? Can we do a urinalysis annually? What do we need to do, et cetera, so that you can have it in the file that you asked, and protect yourself too legally, because unfortunately, you don't want to spend a fortune on something where it was medical error and then now you're stuck footing the bill. Like I do think that Diane, your cat was a domestic short-haired rescue, so it's hard to know what they're
Yes.
predisposed to. That's what my whole life is. But I do
Mm.
like the genetic testing that some companies offer. They are pretty extensive. The one that we did was Embark, I believe. No, Wisdom Panel for Titan,
Mm.
and it checked for like 250 genetic predispositions, so genetic markers, and it checked for if he was a carrier, or if he was actually he had the genetic marker, if he was just a carrier for the marker, which means that his offspring might have had it, and if he had no trace of that genetic marker. So those are good and they help us. And then, like I said, Moose's March is all about the prevention of canine cancer deaths from early detection using these early detection cancer kits. So knowing, like, following us where we go to like Super Zoo and we find out the new products, the things that are coming to the pet parents, and what's available to you, really does help kind of arm you so that if there is some kind of medical error, you can catch it before it's too late. And my heart goes out to this pet parent in Chicago
Oh
whose
yeah,
dog was spayed instead of having her teeth cleaned.
I know.
I don't know that, I don't want anything to sound like we're saying she didn't do her due diligence. Like, that should
Oh
never have
sure.
happened. She
No.
should be able to drop off her pet, having gotten a confirmation for a dental cleaning, and know that she could pick up her pet with clean teeth. Like, that's like basic. That should have
Yeah,
been the
for
first,
sure.
the most basic thing. We're not at all faulting the pet parent. We're just sharing tips that we can all use and implement so that we kind of become a team with our veterinary clinic, as opposed to working against them, knowing that, well, they're human too.
They are. And yeah, I agree with you. Like there absolutely is no fault on this pet parent. I do, like you said, just want to give people some tips, some things to think about when they are talking to their veterinarians, because you see something like this come across your newsfeed and you're like, oh my gosh, could that happen to my pet? Right? Like,
I mean, anything can happen, right? I mean, it's
yeah,
2024. Anything can happen. What do we have? Like, do we have medical veterinary error on our bingo card this year? I don't know, but it really can. Anything can happen in 2024. So really, because we have access to information, education, resources, we really should leverage those when, when we're planning any kind of surgery, medical procedure, anything like that for anybody that's in part of our family. So again, no hate on any pet parent, and that veterinarian, let's talk about that, like, probably feels terrible. Like, that was a huge error. And
yeah,
no hate to
yeah.
the veterinarians at all. Veterinarians work super hard. They are just like everybody else who's doing their best with what they have at the time, with the information and knowledge they're given, that they receive at veterinary school, which is very difficult to get into and to graduate from. Again, like Jessica said, they study tons of species, not just one. They have to remember everything. They're primary care
Yeah.
physician, they're OBGYN, they're pediatrician, they're everything in one. And so the love that I have for veterinarians and respect that I have for veterinarians should overpower anything we said. It's just about finding the right veterinarian for you, for your pets, for your family, for your priorities, and just listening to your gut if it's a mismatch.
Yeah. Well, and also utilizing veterinarians appropriately. I think we've probably talked about that before in the past as well. Like realizing that they are everything in one, or that we expect them to be everything in one, that when they and there are now there are veterinary specialties. It's not easy to always find them. Like there are veterinary oncologists. There are, I don't know what they call them in the veterinary world, but there are like eye doctors. There are places you can go
Ophthalmologist.
just,
Yeah, veterinary
well,
ophthalmologist. Yes.
so like there are specialties, but they are few and far between. They are hard to come by.
Yes.
Um, and I, depending on the veterinarian, that the primary care veterinarian you're working with, they may be quick or they may be hesitant to refer you out. I know there are some veterinarians, and this is just absolutely not, everybody, but different people have different personality types, right? And so you have to find somebody that like you vibe with, that you mesh with. And I know there is one veterinarian that is the closest to me, and I have heard from other veterinarians that he doesn't play well with others. Like, so you have to like know these
Yes,
things.
yes, no, and talk about it. Ask the questions, and again, don't feel like you're a Karen just because you're trying to do your due diligence and advocate for anybody. That's just not it. It really is our responsibility as pet parents. As a matter of fact, for me, when I go into the doctor for whether it's a veterinarian or a pediatrician with any creature that I'm in charge of, I take that so seriously because it's not just about me, it's about them and their future. And like I have kids who maybe want to have children one day. So I'm going to ask questions today that might impact their reproduction later in life and things like that. It's a huge responsibility, but it is a responsibility that we've taken on when we become pet parents, parents to children, whatever pet parenting the type that we do. So knowing that that's your responsibility and not feeling like you're overstepping or you know kind of being out of line. So long as you ask respectfully, you should get a respectful response. And if the veterinarian doesn't have a response, be okay with them following up with you. Don't act like you needed the information right then and there. If they need to, my veterinarian has asked me to email her information about things that I've asked about because she wasn't aware. And then once she's reviewed the information, she'll get back to me. And they're busy, so it's not done in 24 hours. It might be done in 4 days, but she gets back to me, and I appreciate that. Because I understand that they're working with what they can. Another thing is, your veterinarian and your emergency veterinarian are two different things. They serve two different purposes. So don't expect your veterinarian, to be your emergency vet, and don't expect your emergency vet to be like a long-term advisor with your pet care, because that's not their role. And again, the only way you'd know that is if you really, truly take it upon yourself to educate yourself about your species, about your breed, about the veterinarians in your area. And just follow people like Jessica, myself, Dr. Z's. I cannot pronounce his last name, but he's wonderful. He's always sharing surgeries, which he does in a way that actually doesn't make me want to lose my lunch. So if you're squeamish, you could probably still get away with that. There's a ton of veterinarians for nutrition. Jessica is constantly interviewing experts in that. So just follow her podcast and you'll see all the people you should be following and learning from. And just going back to what you said about the veterinary oncologists, what I learned from Trisha Montgomery in this week's episode is that there are only 400 in the country.
There are very few.
Yes, there are very few. So once you get to that point, you may not be able to reach. I don't think we have one in El Paso, for example. So I may be not stuck, but for lack of a better word, I may have to be happy with the veterinarian that I have here, dealing with something that may be a little bit beyond their scope and their specialization, but that might just be my reality. So taking extra precautions, if that is the case, would be merited, because obviously you're not working with a specialist in cancer, you're working with a primary care veterinarian who is, dealing with your pet's cancer. Not to say that they can't handle it, because my dog Radar needed his eye removed, and the ophthalmologist here was going to charge me $5,000, and my vet did it for $1,500, and she did a beautiful job. I mean, she was literally removing an eye that no longer served its purpose, so we didn't need to invest $5,000 in that. So it can work out in your favor as well to not go with the specialist for certain situations.
Yeah. You just have to do your research and do your best to follow your gut, because I know in some situations it's like there's so much adrenaline, you're so scared, you're so nervous. Emergency situations, like, that's hard, which is why the more you kind of bank, the easier it is for you to make decisions moving
Yes.
forward in those high pressure situations.
I would love to know if that pet parent had some red flags
I would
from
love to know.
visits.
I cannot, and I know this, I mean, it just sounds like I'm bashing Banfield, and I guess in a way I am, but I cannot imagine walking into any Banfield in the country and not having red flags, knowing what I know. But
Correct.
for her, I do wonder, like, how
Exactly.
she felt about it.
Correct, because everybody has different kind of buying points,
Yeah.
right? So like for me,
Yeah.
it's like I don't care what the like weight area looks like. I don't care if it has cute art on the walls. Like I don't care about any of that. Obviously, I want it to be clean. That's a
Yeah.
red flag to me. I want it to be, friendly. I went to an emergency vet here where they were like a dog was bleeding out like out front and they didn't have time to address that red flag because they genuinely were in surgery trying to save another dog.
Yeah.
But they were so short staffed that nobody was there to put a bandage on this dog. Red flag, you know what I mean? So those kinds of things, like I know what to look for. I know that there are basic things that we all look for. But yeah, I would love to know if she walked in and was like, I don't know, like I hate this about this, or maybe this particular Banfield has a great team and a great front office, and maybe she felt super duper comfortable, and there was no way she would ever have known that this could possibly even happen. Because honestly, that's why we're talking about it, because I've never seen this in the almost 20 years that I have been in the pet industry. I've never seen an article where a veterinarian spayed a dog instead of cleaning their teeth.
Yeah.
I've never seen it. So like she
Yeah.
obviously did not know that that was a possibility, but now that we've discussed it, we all know and we all can kind of cover our
Well,
bases.
and the reality is that if we look at like every year, and I don't know if they're going to keep doing this because we talked about how Nationwide is like canceling everybody. But they all, like, I think ASPC, all of them, they put out their lists of like what are the top things that animals are dying of every year, what are the top things they're paying out claims for, like all of that. And the list almost always mirrors the lists in human medicine. So as far as like the top 3 things that humans die from are the same top 3 things, generally speaking, that pets die from. And number 3 for humans is medical error. So even though there's not really good reporting, I don't know. I can only assume it's because pets in this country are considered property. And so veterinarians just don't have to report the same things that human doctors have to report. I guess, I assume. But I can only imagine that it is pretty high up there if it's that high up there for humans.
Yeah, 250,000 people minimum in the US die each year because of medical error. 250,000 people.
Yeah. Yeah. So I'm hearing myself all of a sudden.
No, it's because my headphones died.
Oh, okay.
My apologies. Well, thank
No,
you
it's
guys
okay.
for joining us. That's an hour. We usually try to limit these to an hour. If you have any recommendations for any topics you want to discuss next week, I believe we are meeting next week on Monday at 3 p.m. Mountain Standard Time. That's 4 p.m. Central, where Jessica is. We haven't decided a topic. We like to keep it kind of short notice just because we want it to be the Weekly Pet Roundup, something that happened recently. There are studies that have come out that are really interesting that we could talk about, maybe, carefully discussing the spay and neuter situation or information that came out through Rodney Habib.
I don't carefully discuss anything, Isabel.
We do. We're very careful. We're very careful and we're very opinionated, but in the best way, in my humble opinion. So yeah, if you have any recommendations, things you want to talk about, things that are pressing, things that are in your life that you want to catch up on. Really, you can hear me so much better without the headphones in. Headphones, vaccines that are not needed. Okay, that's another topic we need to handle carefully. Yes. Thank you, Ryan. I'm so sorry that my sound was not good. I wish I had a way to fix that, but my family likes to sabotage me, and they like to take my headphones every single week, And Jessica's like, wasn't it last week you lost them? I said, yeah, the week before and the week before that. And so I will do my best to do a better job of locking them away and throwing away the key for everybody else. But Jessica, when you redo this, then maybe we use the audio from the YouTube instead of the podcast, because this will come out on Jessica's podcast feed, the Pet Parenting Reset. And if the sound is better on YouTube, we'll just use that.
Yeah, I can do that.
If you could use that, that'd be great. So thank you guys for joining us. Have an awesome rest of the week.
Bye.